We're going to take a look at some of the specific sites that are available through the local health professionals page. At the end of the session, I'll have a short poll for you, and I will be sending you an evaluation just to follow up via email. Now, the clic-on-health website, if you were here last week, you know this, but if you're joining us as a new participant, the clic-on-health website is administered by the Rochester Regional Library Council, and it's available to anyone who has internet access. clic-on-health has in the past it's been used for consumer health information, but since 2010 we have been using it to train local health professionals that do not have access to library resources and databases through an affiliation with, say, the University of Rochester or local hospitals or colleges. So what we're going to look at today is, again, this page, the local health professionals page, can be used by anyone, but the emphasis is on resources that are going to be of interest to the health professional. And the websites on this page, they're vetted, they're of good quality, and many were recommended to us through collaboration with the clic-on-health steering committee, with nursing school faculty and Rochester area librarians. We're going to go right then to the local health professionals page. You can also access the resources through the banner, but let's do that. And as I mentioned, we're going to pick out a few of them. The next two sessions that we've scheduled, we will be looking at some of the consumer health and drug medication websites, as well as the Novel New York databases. But today we're going to go through a few, as I mentioned, resources that will provide access to evidence-based clinical literature. And our emphasis is on how to find information that is free full text. So when I do training in these databases, we do talk a lot about how you can do a good search, but find it free right at the point in which you're searching. Now, not everything is available free full text, but we'll talk about that in terms of options for you. So let's go now to our PubMed Medline link. And we have information about PubMed here. We also have a link that will take you right to the PubMed database. Now, what's PubMed? Well, PubMed is a database that's produced by the National Library of Medicine, has millions of references, articles that are published in biomedical and related journals, and it is really the database. If you are a health professional, you want to be able to access this information. And you know, why use it? Well, it's where you're going to find the clinical evidence-based information that's going to be of interest to physicians, nurses, and other allied health professionals. And a lot of what is available in PubMed Medline is free and full text. Not everything, but a lot of it is. So I'm going to show you some searches that will demonstrate how you can easily find free full text information. By the way, there is a series of really excellent tutorials. I'm going to click right there. It will take you right to the National Library of Medicine, and there are they're fairly short. They give you the time in terms of the length of each tutorial, and they're very specific. So if you want more information about how to search PubMed, how to use the mesh terminology and so forth, they really have a tutorial. There's something for everybody. Okay, so we will refer to that, but those are tutorials that you may want to make use of. Let me tell you too, again, I'm going to go in and do a couple of searches that will show you how to find the article right as you're doing the search. But if you are not able to find information full text, you can set up, I'm going to skip down here, Lonesome Doc is a service that's provided through medical libraries. In this case, the local provider is the University of Rochester Edward G. Minor Library. And you can set up, basically you contract with the library, and they would provide reprints for you. Now, there is a cost. They're not actually working with, my understanding, with organizations right now, so it would be a personal use of the service, but that's what Lonesome Doc's about. Now, link out is if you are, say, you're at the University of Rochester and you're searching PubMed, they will link out to the journals that are a part of their collection, and many medical libraries have this. It's not going to help you with the clic-on-health because we don't actually provide access to some of the collection that is not full text on PubMed Medline. And then PubMed Central is it's from the National Institute of Health, and it's basically an archive of many biomedical and life science journals. And when we search PubMed, you'll see that you will be able to access material that is a part of the PubMed Central. More and more material that's being put into PubMed is going to be free, full text. So let's go ahead and take a look. We're going to go right into PubMed Medline, and you can enter a search right on the main search screen. Here again are some other, features. I mentioned the PubMed tutorials. There's an FAQ, and there's a couple other things that I'm going to go back and talk about in a few minutes. But let me just show you, if you're doing a search on PubMed, a couple of quick searches using, say, keyword searching. And also we're going to do a search on using the control vocabulary, which is the MESH vocabulary. So, using PubMed, it's not terribly difficult to use PubMed Medline, but there are definitely ways that you can improve the way you search more effectively, more efficiently. So let me give you an example here. I'm going to type in, and again, it's just a keyword term that I'm going to be typing in. I'm going to put in, let's see, wound care. Okay, and see what it's doing? It's bringing up topics that have already been searched, and perhaps there's one more relevant than wound care. In this case, I think I'm going to pick diabetic wound care. All right, and it fairly quickly found quite a few articles. It will display them, in this case, 22 a page, but there's over 1,150 articles here. So sometimes the issue when you're searching PubMed is not that you don't get anything, you get too much. So again, this is just a keyword search, but what I would do right now is I would, first of all, limit the result. And there's, you can filter it too. You can see automatically it will filter your result to give you, in this case, free full text. It's 114. Or 313 that are review articles. And you can go and take a look at those right now, but you probably want to do it's always a good idea to be able to limit your search. You can refine it in a number of different ways. Before we do that, however, when you do a search, you want to take a look at the record, actually the screen here, and it'll give you an idea of how you've done your search here. In this case, there's titles with your search term. Maybe those are interesting to you. There happen to be 52 free full-text articles in PubMed Central. There's a PubMed Central again. Here, it's always, it's always good when you're doing searching to look at the details, and that means it'll tell you how your topic was searched. And in this case, it was searched in all fields, a text kind of keyword, but it was also searched via the MESH vocabulary, and we'll talk about that in a couple of minutes, because if you're going to be doing searching on PubMed Medline, you want to be able to do both kind of a keyword search, and you also want to know how to use the MESH terminology. All right, so let me go back here. We've done a real quick search. We're going to limit the result of the search, and up here you can click on limit. And there really are quite a few limits that you can apply to get a better result. Now, if you're interested in limiting it, say, to the last 3 years, you can do that. You can limit it to the type of article. There are quite a few different article types. There's also publication types, so if that's important to you, I won't go through the whole thing, but you get the idea. You can specify the type of publication, type of article that you're interested in. Language, okay, you're going to get all languages unless you indicate otherwise. So for my search right now, I just want English. And then there are other limits, species, sex, different subsets, age group. Just remember, the more limits you apply, the smaller the result. You might limit yourself out of any results at all. But in this case, I'm going to keep it simple. I'm going to do 3 years in English. And I do want to link to free full text. You don't have to. But this is a limit that, again, if you're looking for something relevant and you want just the free full text, that's an option that you can apply in this limit screen. So let's go ahead and search that. Okay, and that did reduce the result quite a bit, but it might give you, some good articles. There's 44 of them. And, you can look at each one and it will tell you if it's a free PubMed Central. Sometimes you'll just see free article, and that's a link to the publisher site. Sometimes you'll see an article that has a link to both the publisher site and the Biomed Central database as well. So let's just select one. I'm just going to pick number 2 here. Okay, and it gives me some information about the article title, the authors, affiliation of the authors, and an abstract. There's some images here as well. And this is where you can link out. In this case, there's the publisher site has a full text availability and the free full text in Biomed Central. Okay, now you can view the article, you can print it. You should be able to download it, email it, and so forth, but this is a full text presentation of this particular article. So you get the idea, I hope, that you can do fairly easily a keyword search, limiting the result to years of publication, language, free full text, and then actually look at the article and produce the article itself. Just remember, when you're doing multiple searches on PubMed, Medline, and you've activated your limits, those limits are there, and they're going to limit all additional searches unless you remove them. So say you're going to do a brand new search and you want to apply other limits, you can remove the limits just pretty easily. And there you go. Okay, so that was a kind of a quick and dirty keyword search. Automatic term mapping allows you to find articles that might be relevant, and you can do your limits and you can do your free full text. Again, we emphasize, because we've been told lots of times that folks just want to get the article, and we will talk about what happens if you can't find it online, but that's a pretty easy way to filter, review, limit your search to free full text. Okay, let's go on and do another search on PubMed Medline, and I want to talk about mesh searching. All right, mesh stands for medical subject headings, and it's the control vocabulary that's used to index articles in Medline. If you go to the main Medline PubMed screen, you can find a link to the mesh database there. But if you want, you can actually look at the pull-down window, and you can see there's lots of different databases that are available through the National Library of Medicine, not just PubMed. We're going to find mesh, okay? And let me get rid of this term. So what I want to do right now is I want to do a search, and I'm going to search on, let's see, bed sores. And I'm going to enter it right on the line here. Now, you remember when we did the other search, it did an automatic mapping and it found terms in PubMed Medline. Well, this is a little different because I'm actually asking to search for the mesh term, the medical subject heading, that is used to describe articles that talk about bed sores. So let's go ahead and do that. Okay, now the reason you'd want to use mesh, because in some cases a topic may be described in the literature using different terms, and mesh takes this into consideration. So articles that present variations on spelling, if they use different term synonyms, they'll all be, if they're on a topic, they'll all be indexed with a authoritative subject heading, a control vocabulary term. And so when you use mesh, it searches for more than just the occurrence of the word. It will search for the occurrence of a word, but it will also search for articles that are indexed with a specific mesh heading. And also when you search for mesh headings, you can search on very specific aspects of the topic. So in this case, searching for the mesh, searching the term bed sores, it brings up the mesh term pressure ulcer, and that is the mesh term that is used, that's actually indexed articles that talk about bed sores. Okay, and it gives you a little bit of information about, what pressure ulcer is. And here is where you can select subheadings. And now subheadings, again, allow you to search on very specific aspects of your topic. So if you're interested in the drug therapy, or the nursing care, or the prevention and control of pressure ulcers, you can really get specific and say, that's just what I want. I don't, necessarily want other aspects. You may get that, but this will guarantee that you will search for articles that talk about these particular aspects of pressure ulcers. And you can also restrict the articles to a discussion of this topic as a major point of discussion of the article. So you are going to get relevant articles here. And it tells you that these terms here, articles about all these different topics, are going to be indexed with pressure ulcer. Okay, and just to tell you too, all medical subject headings are in a hierarchy, so there will be more general terms and there might be more specific terms. In this case, skin ulcer is more general, and there apparently is not there's not a more specific terms that's used for pressure ulcer. So I think we're on target here. You can see if I search it, okay, let me go up, I'm sorry. I'm going to just add to my search builder. And I can just go ahead and search this PubMed, but I want to add to the bed sores, to the pressure ulcer topic, the topic of nursing homes. And I want to then find articles that talk about the drug treatment, nursing, and prevention and control of pressure ulcers in a nursing home setting. So right now I've created this mesh search, or I'm about to. I'm going to add it to the search builder. And you see how quickly it found it as a mesh heading with our subheadings attached. All right, so let me do another search here. Remember, I'm building a search. I'm going to put in or ask for the mesh term for nursing homes, and there we go. Okay, and again, you have the option to apply subheadings. I'm not going to apply subheadings in this case, but you could. It tells me here the terms, the relationship with more broader categories and more specific categories. So under nursing homes, you're also going to get articles that bring in intermediate care facilities and skilled nursing facilities. Okay, so let's add to the search builder. And now we're ready to go to search PubMed on the pressure ulcer bed sores topic, ending it with the nursing homes. And we'll search PubMed. Okay, so let's remember that we do want to apply limits. And just by the way, when you see an article title in brackets, that means it's not in English. It'll tell you, in this case, it's German. So if you just want to go ahead and go back, you remember when we applied limits, you can limit it by year of publication if you want. You don't have to. We'll do 5 years, English language. And let's do our free full text. Okay, so that reduced it, but you know, maybe it's better that you have a smaller number that are more relevant. And let's go ahead and look at this one, randomized clinical trial on preventing pressure ulcers with wheelchair seat cushions. Okay, so just keep in mind all these articles are going to be indexed with the mesh terms we specifically searched for, the pressure ulcers, therapy, nursing care, or prevention control, and the nursing home terms as well. Okay, so there's a little bit of information, and you can link out, in this case, to the publisher site or to the Biomed Central, and you'll get the article in full text. Okay, so that is, again, well, it is a pretty quick, let me just go back a little bit here, I'm sorry, a pretty quick way to do both a keyword search and also using mesh terminology. And they're both, you know, important ways for you to search the database. If you go back to the main screen here, you can also do advanced searching. If you click on that, you can search on any number of other fields. You can look for an author. Okay, you can look for a journal. And you can do combination searching here. You can and or not. If you wanted to, you can add additional lines to your search. Let me just type in, let's see, Watson J, okay, and the British Medical Journal, okay. Now I know this search should work because I've done it before, but hopefully you'll get the idea that you can search in combination not only on subjects, ending multiple subjects together, but you can also search for author and journal and combination. So let's see if we should get a result there. Yep. Okay, so we got articles by Watson J. In this case, there's a Watson JM also that appear in the British Medical Journal. You can enter terms right on the main line together too if you want to just put in, say, as long as you spell correctly. I always have an issue with the spelling. And this should work. And it will, I believe it'll search it as both mesh and as text words. And you can always check that by going to your search details box. It's a good idea if you're going to search this database to get kind of into the practice of seeing how your search was done. Okay, so let me go back one more time here to the main PubMed homepage. And here, again, you can do your search. You can go into PubMed, or you can go back into mesh from here. You can get to mesh from here. All right. There are other databases that you can go to. The clinical trials is one. Let me, before we leave PubMed Medline, let me tell you here that you can also search on something called clinical queries. You can enter a term and it will search the topic in a variety of categories here: clinical study categories, systematic reviews, and then medical genetics. Now this one, systematic reviews, it will bring up reviews of clinical trials and evidence-based medicine. So that might be, you know, again, if you're looking for something that's specific, you can search it from here. But you can also go back. It is one of the, if you were just to do a subject search and then you went to the limit page, let's see here. I believe that that is a subset, the systematic reviews. So you could do a search from this screen, enter your topic, and then just ask for the systematic reviews. So again, that's, you know, an option for you. And then remember, you got it? Okay. You know, again, if what you're interested in is a specific kind of literature, systematic reviews, evidence-based, that might be an option for you. And all of them, however you do your searching, whether it's keyword or mesh searching, remember to use your limits and also free full text, which you can just, when the screen comes up at the first point of searching, you'll see there's a filter, but you can also apply the limit, which is on the limit page here, links to free full text. Okay. All right, so again, that's a whole lot of information on a really important database that you should be aware of if you are looking for clinical evidence-based literature. Hopefully you got a good idea of how to do your searching and be able to find full text, free full text fairly easily. Okay, so let's move out of PubMed Medline. We're going to go back to the local health professionals page. And we're going to quickly look at the NLM, which is National Library of Medicine Gateway. What the NLM Gateway allows you to do is to search on, it's actually only 2 databases right now. You can search them simultaneously. The databases are the meeting abstracts and the health services research projects. So possibly, you know, you're doing research and you want to be able to see what else, you know, what other research in your area of interest is going on out there. So what I'm going to do is I'm just going to show you a quick search here. We'll put in breast cancer screening and insurance. Okay. All right, now there's 285 from meeting abstracts, and there's also 69 from the health services research projects. Now these are not links to full text. I know I made a big deal talking about how, you know, we talk to folks about how you can get free full text. Well, in this presentation, these are not available full text, but you can link to contact information. So if, for instance, we'll take a look at the Health Services Research Project. If you find that someone is doing the same type of research that you or your you know, colleagues are doing, maybe this is something you can take a look at here. We're just going to link, and it will give you information that includes contact information and a website and the supporting agencies and so forth. So again, if you're involved with any kind of research, this might be an important resource for you to become aware of. Okay, so let's continue. All right, so we've looked at PubMed Medline. We've looked at the NLM Gateway. Now let's take a look at some of the clinical practice guidelines, best practices websites that we link out to. So you're getting the idea. We're not clic-on-health doesn't create the content. We're linking out to resources that actually have been, as I mentioned, vetted, but recommended to us by health professionals and librarians in the Rochester area. What we've done here, again, we've tried to emphasize free, full text, but some of the sites do require subscription, and then the material is free, or in some cases payment is required. So I do still want to show you the ones that have limited free access, because there will probably be information there that will be useful to you. So let's go down the list here. What we have first is from the Agency for Healthcare Research and Quality. We have an evidence-based handbook for nurses, and we also have a link to the Agency for Healthcare Research and Quality Patient Safety Network. Okay, so let's go in and look at the evidence-based handbook for nurses. It's a textbook, basically, electronic book, so you can page through it in terms of the table of contents. You can link to different sections. If you go back up to the top, you'll be able to do that from this point. So if you want to go, zoom right to the evidence-based practice chapters, you're able to do that. These are PDF files, so you can actually get the full chapter view. Again, more subject areas that you can go to. You can also search the content here. Let's see here. We'll put in catheter infection. And it will search the content of this pretty quickly, this electronic text, and tell you where in the chapters you'll be able to find information on the topic. There's also an advanced search, and there's search tips. Most of these databases do have either tutorials or search tips that you can use. If you find that you are using one fairly regularly, you probably want to acquaint yourself with the search tips. It's always useful to know, the ins and outs of these databases. Okay, so let's continue here. We're going to take a look at the Patient Safety Network. Okay, so again, this is from the Agency for Healthcare Research and Quality, and you'll find there are specific journal articles, new for the week. There are book reports, newspaper, magazine articles, web resources, conferences, and so forth. There's also here, let's see here, you can browse the collection and view the classics. Apparently, they have put into this feature the most influential journal articles, books, and resources, and also the most popular. So you can, go through that. I'll just click here. Not all of these are going to be available full text right at this point. If you were to click on this PubMed citation, it would take you into PubMed Medline, and I believe there you'd be able to search it full text. So that's an option for you. Also, I think if you click here, it's going to bring you to the, let's do that. Okay, it brings you to the publisher's site, and it looks like it is full text, so that's good. Okay. So it may actually bring you out of the particular safety network to a different source that you can obtain the full text. Okay, so let's keep moving. We're going to go next to the National Guideline Clearinghouse, which is, we've stated here, a public resource for evidence-based clinical practices. We have it linked actually in two ways. We have it linked the National Guideline Clearinghouse homepage. You can search, and we'll go in there in a minute. But you can also search on what they call a synthesis list. Okay, it contains a syntheses of selected guidelines that cover similar topics. So let me show you how to. We'll go in first of all to the homepage here, and you can search the site. You can just plug in a term to search. You can browse by topic or by organization. Remember, there's a whole group, different organization agencies that actually provide the guidelines that are in this database. You can also search the index. The advanced search is quite comprehensive. You have quite a bit of limits, I guess, you can apply by searching. You may not necessarily want to do this, but it really is up to you. If you type in a keyword, you can search for age population, target population, all the different methods used to, assess. It says here the quality and strength of the evidence, and quite a few other things that you folks would probably be better judged than I am in terms of how you would search it. Then there's publication year and the sex of target population and so forth. But if you just want to search on a particular keyword, you can do that. I'm just going to type in otitis media. Whoops. Whoops, I'm sorry. If you don't spell. And again, if you wanted to add any of these, limits, you could. Otherwise, we'll just show the results here. Okay, it found 23, and again, they, will talk about the topic that you searched, otitis media, and they are from different organizations, different agencies that have developed these guidelines. So you can go through them and kind of pick and choose. If you prefer, again, you can go to the guidelines synthesis, which we do link from our page here. You can get to it from where we just were. And it will let you search on, on the topic, and it will bring up guidelines from various agencies. And the definition that they give for synthesis, which I have a hard time saying, are systematic comparisons of selected guidelines that address similar topic areas. So key elements of each synthesis include a discussion of the areas of agreement and differences, and the major recommendations and the corresponding strengths of evidence and recommendation rating schemes. And they also compare guideline methodologies. And then you're going to see the source of funding and the benefits harm of implementing guideline recommendations and so forth. So that, if you're not sure, if you've got competing recommendations, this might be a good resource for you to check out. Okay. All right, we'll go back here to the Clinical Practice Guideline Best Practices page. I went back a little too far. So we've looked at these 3 resources so far, and we're going to continue. We're going to look at a few resources that have some great information, but not necessarily everything there is free full text. So just keep that in mind. Again, we try to emphasize that most of what you can find here is going to be free, but there is some limitations for some of these resources. So let's take a look at the Practice Guidelines Registered Nurses Association of Ontario, including they have what they call a Best Practices Toolkit. Okay, so what you're able to do, for the most part from this database, is that you can actually look at their practice guidelines. There's some featured best practice guidelines. There's also guidelines and fact sheets, and then they have they have another link here, the clinical practice guidelines, and then they have a best practices toolkit. Well, let's take a look here at the featured best practice guideline. In this case, it's ostomy care and management. And you can link to a series of downloadable PDF files here if you are interested in this topic. You can also take a look at the guidelines and fact sheets. And they have them arranged by category, also different languages, by general category here. If you click on that, the particular topic here will actually give you, again, some downloadable files. Okay, and then we'll take a look quickly here at the Best Practices Toolkit. And this one is specific to long-term care, and what they have entered here is basically information that if you're in, long-term care practice, there's different topics here that will have best practice standard information for you to take a look at. And these are all available full text. There's a pressure ulcer topic that we searched on in Medline Plus. And let's see here, they do go into some pretty good detail in terms of best practices and standards. And most of these are available. Somewhere you go out on the the net for, but some are available in PDF or Word files. Okay, let's continue here. Our next link is from the University of Iowa College of Nursing Evidence-Based Practice Guidelines, and this was recommended to us by our some of the nursing faculty in the area nursing schools. This it does require payment. You can search here for the catalog. You can see the contents of what is available. And the price is there. You can get a hard copy or CD-ROM or a set, and they will give you information on what the topic is about here. And then you can, there's an order form there too, so. Okay. All right, let's move on here. The Joanna Briggs Institute Best Practice Series Database. We're going to take a look here. Some sections do require a subscription, but there is a lot of free information here as well. You can just go right to Advanced Search. Okay. And you can ask for your topic in specific document types, but I'm just going to search everything, and I'm going to type in. I guess we'll put in bed sores again. Okay, now here what you're going to see, they've got little boxes here, and they present the results in terms of their categories of evidence summary, and apparently there are 11, evidence-based recommended practice. You can see here some of them do require subscription, but there are some that are available right there, either you know, in a PDF or HTML. So you'll see that a lot of the information for consumers, or in this case technical reports or systematic review protocols, those you can actually link to right there and then. Okay. All right, let me go back there a little bit. All right, let's move on here. We're going to look at the Cochrane Database of Systematic Reviews. So you're going to be able to find answers to clinical questions about effectiveness of treatments. You can also search by summary. Let's go in here and look at the Cochrane Library. And you can search, again, you can type in your term, just search it as a keyword, or you can look at their categories. They have it kind of broken down in general categories. So I'm going to look here under anesthesia and pain control. And they further break it down. If you wanted acute pain, let's say you're interested in looking at the complementary and alternative therapy of acute pain, and they have a few articles here that are on that, in that category. Let's take a look at music for pain relief. Okay, and it will provide you with some limited information, a summary. Okay, and again, it is a summary, so if you want the actual full article, you need to actually pay for it. And apparently some states do provide access, excuse me, statewide to the Cochrane Library, and many libraries do as well, but in this case, clic-on-health will provide a link to the information, and if you want to purchase it, you can click on Access, and there's a pay-per-view, so you can actually, you know, find the article and then you can pay for it from there. Alternative, if you're going to be searching, let's see here, back on our page, you want to search the Cochrane database by summary. That is also something you're able to do. You can just type in, let's type in that migraine search there. As long as you spell it okay. Okay, well, there was one, and you can view it, and again, it is a summary. So there's, you know, a variety of ways you can search this, again, doing category searches or keyword searches, or you can browse health topics as well. So it's a great resource. Again, unfortunately, it isn't available completely free, full text, but it will get you started in terms of accessing this information. All right, let's keep moving here. I do want to talk about from this page, we talked about these resources, these databases providing access to evidence-based clinical practice guidelines, best practices. Well, we've also included the TRIP database. And if you're interested in using a search engine to search multiple resources, instead of doing Google, if you're looking for evidence-based resources, my suggestion is you try the TRIP database. It stands for Turning Research into Practice. And what you're going to be able to see when we do a search is that it's going to search multiple databases, some of the ones we just looked at, PubMed, National Guideline Clearinghouse, the Cochrane Library, and much more. Free registration will allow you to be notified if you have a search that you want to receive updates on. Every time there's a new information in the database, it will update you on that. And it's free registration. It is from the UK, so it is heavy on the UK sources, but it does cover worldwide sources, including the United States. And there's also a kind of a neat FAQ type section of TRIP. It's called TRIP Answers, and it collects the questions that have been asked, because it's an interactive database where health professionals have actually posed questions. Consumers could be doing it too, but most of the questions look like they're from clinicians. They will pose questions, and then they'll create an FAQ. Maybe the question you're interested in has already been asked. So let's go ahead and take a look at the database itself, the search engine, TRIP. And let's type in, let's see what we can type in. How about catheter? Okay, see how it is doing the automatic mapping. I wanted catheter infection, and that's, you can find that there. There's other terms as well, but let's just go ahead and search that. All right, and the search results, it provides you with, basically did the search across a number of different databases. It also allows you to filter your search, and they do have color coding here, so you can see evidence-based synopsis, systematic reviews, guidelines. Here's the number that have come up. If you wanted to go to the U.S., they've got 199 that are published in the U.S. in this category. And there's other types of information as well. There's patient information, there's news, there's e-textbooks, so the variety of formats in which the information appears is kind of cool. Clinical area, if that would, you'd be the judge as to how you wanted to search that. But here's Medline. So what you're able to do here, if you did a search on this search engine, you can see that there's quite a few, 941 articles on catheter infection therapy or diagnosis, or 211. And you can link right to the Medline, PubMed Medline database, and then continue your search. So from that point, if you wanted to find out of that 941 what is free full text, you can quickly do that. Now, if you did this on Google, I'm not sure what your result would be, but this is definitely an alternative if you want to be able to search multiple evidence-based resources. Clinical Trials is another database, and then the BNF, I believe that's the British National Formulary. Doesn't look like it had any results, but that's what that stands for. So I think it's kind of a cool tool to use. If again you want to look for the evidence-based type of information. And then here, let's just check out quickly TRIP Answers. And I'm going to put in, let's see, deep venous thrombosis and air travel. And you can see how there are other questions that are featured that are coming up. All right, and here's the question that someone already asked. What's the current advice about deep vein thrombosis prevention for someone who has had a previous history of deep vein thrombosis after long-haul air travel? And then you can go in and take a look and see what it presents. So, probably what you're interested in, other folks are interested in as well. So again, that's TRIP, and I think it's a nice tool for you in terms of searching evidence-based information. Okay, so we are quickly getting through the information I wanted to talk to you about today. We're going to continue. We're going to go back to the local health professionals page. We're going to look at some of the online journals, and then we'll have an opportunity, hopefully, for some questions. So I'm going to go through this pretty quickly, but I just want to bring it to your attention. These were recommended to us, and some of them do require a password subscription, and some provide free text, full free text, others limited access. So let me just quickly go through here the Biomed Central journals. These are available on PubMed Medline, and they're in all different subjects, biomedical in nature, and you can browse them by the title, or you can search by subject. So again, at your leisure, if you're interested in any of these, you can link to, again, the journals and the articles, and they are on PubMed as well. And then some of them will tell you that they do require subscription. Okay. Emerging infectious disease is available from the Centers for Disease Control and Prevention. This is also on PubMed Medline, but if you're interested, you can actually come here and search the latest issue and past issues. It's also available through podcast. So if this is your topic of interest, it's probably the place to go to search on any kind of emerging infectious diseases. All right, Medscape Nurses, Journals and References, a neat website. It will provide access to a whole series of nursing publications and nursing-related information. It does require a password, but login, but it is free. So there's latest journal articles, there's specific nursing journals. Let me go back to the nursing Medscape for nurses, and there's a whole bunch of other information that, again, is going to be of great interest to nurses. I can log in. Okay, I guess I was logged in. Okay, let me log in. Again, it doesn't cost anything to subscribe. And let me see, I don't really use this a whole lot, but I have viewed it and had pretty good success. Okay, so I'm logged in, so I can take a look at what is here available free. We don't have a whole lot of advertisements on our websites, or actually, let me say it in a different way. We have chosen not to link to most of the websites we have do not have advertisements. Some do. So this one, again, the quality of this particular resource, even though it does have some advertisements, we decided to include it. So generally our policy is that we don't really want websites that have a lot of advertisements. Okay, here is the New England Journal of Medicine. There is limited free full text. The latest couple of, again, it's not everything that's on New England Journal of Medicine. They do want you to subscribe, but they have latest issues and previous issues too. You can search quite a few years back. I've noticed they have some from the 1800s there, so it's kind of interesting if that's what you'd like to take a look at. Nursing Center.com is, again, nursing information, nursing journals rather, and you do register for this. It is, I believe, free. I have not registered for this, but this is something if you're a nurse or you work with nurses, this is definitely a resource that would be of interest to them. Okay, we're keep on moving so we can get some questions in. The Online Journal of Issues in Nursing. Again, you can see that when we first developed this website, our target was RNs, nursing LPNs, so a lot of what we do have here is nursing specific, and these are full text articles. And one last one here, we have worldwide wounds, so if you're involved in the care of patients that have wound care is required, this might be an interesting resource for you to take a look at. Okay, I know I went through that pretty quickly. Well, we've got just a couple of minutes. All right, so let's see here. How about if we have any questions? Can we unmute everybody if that's something? Can you do that? Okay. And if we can't hear your question, if you want to pose a question, April's monitoring questions. Anybody have a question? You can also, if after the session you want to email me questions, I'd be happy to answer your questions that way also. I'm not hearing questions. Does anybody want to pose one? Anybody asking? No? Okay. Well, I will be sending out an evaluation. Hopefully you can provide me with some input, or if you have questions or comments about what we've done today, that would be helpful for us. In terms of our remaining webinars, let's see, we have 2 more. April 9th, we're going to be looking at the drug medication information sites as well as the consumer websites. That should be a good one because there's lots of really great consumer health websites that both the consumer and the health professional are going to want to be aware of. And then April 17th, we're going to be talking about the New York State Library Novel New York databases, health databases, and some additional resources available through Rochester area libraries. Okay, what I would like to do now is I would just like to ask, we've got a poll here, and I just want to pose a couple of questions for you, and you can respond to this right online here. So if you could answer that, okay. And I've got one more. I'm going to try to do this one too. Can't seem to send that second question. Well, I have a second question that I can't seem to launch it. Let me try it again here. The second one? Okay. Here we go. Okay. I'm interested to know, and I do ask this in the follow-up evaluation, but I'm interested to know, when you attended today, was there anybody with you? You know, if there's a group of 50 people sitting behind you, that would be great for us to know that. But again, if you can respond to the SurveyMonkey survey I'll be sending out today or tomorrow, that would help us greatly. Okay, well, I would like to thank you all for joining us today. I hope that you can join us for the next 2 sessions. If you have any comments or questions, again, you can contact me pretty easily, bchambor@rrlc.org.